And we're back here on Inside Indy. And joining us in the studio, Dr. Lori Buzzetti. And she is the founder and president of So Big, which is a not-for-profit, and So Big Mountain House, which is a maternity house for women, right?
Correct, yes.
Welcome to Inside Indy.
Thank you for having me.
Tell us first about So Big and So Big Mountain House.
So Big was created when I received a call from God about 10 years ago. Amen. And I am an obstetrician, a gynecologist, and I was working in the residency program at St. Vincent's Hospital. And at that time, I was head of the women's clinic, and so supervised the residents taking care of women that oftentimes were in need. And so we would see women that were in shelters, women that were living out of their cars, and just during that time, God pressed it into my heart that He wanted me to help Him create a home where women would be able to have opportunities to choose life and would be able to get back on their feet so they could create better tomorrows for their families.
Wow, I have tears in my eyes just hearing that, because you were seeing this firsthand.
Yes.
And then you saw this need. Tell us about those needs. Tell us what you saw the women going through and what typically might force them into a decision not to carry that pregnancy?
Right. So we would see women that just would be in a relationship where once their boyfriend found out they were pregnant, they just didn't want to live together with them anymore, and so then they would have no place to go. Or they would have an unplanned pregnancy where they already had several kids and just didn't know how they were going to be able to support one more. So they would often be in our office and were just crying because they felt like they didn't want to choose something like abortion, but didn't know where else they could turn and what kind of options were out there. So it just helped to fuel the call that I had received from God to just create a place, a home where they would feel loved, but also create a place where they could connect with resources that they may not even be aware of that could help them.
And when you say the resources that they can access, what are some things that they typically need? Just
getting connected with WIC that can help them provide formula and food during pregnancy, and just helping them kind of navigate through and getting connected with a doctor for prenatal care if they haven't done that. Just helping them get on some other programs that will help them support their families while they're working to become educated or get a job that would help them to be self-sufficient.
Now, what's the age range that you typically would work with, or who you would see coming through the hospital that initially inspired you to do this?
All ages, really. So, typically what I was seeing was women in their 20s. So we take women starting at age 18 and over. So.
Okay. So the name's So Big. What's that mean? Why so big?
So when we originally founded our not-for-profit, we called it the chrysalis community. We chose that because the chrysalis was a sign of transformation, which is what we want for these women. And then we just knew that we wanted the community to come alongside us and help us as we walked alongside these women. And as we got ready to develop our logo and our website, we met with a company called Fishhook here in town. And as they met with us initially, they said, "How do you feel about your name? Because it's kind of hard to say and spell." And so we agreed. And so they just we went on a brainstorming session with them, and they presented the name So Big, and we just immediately loved it because we knew that the plans that God had for this were so big we couldn't even imagine it.
Wow.
So.
Wow. And then the So Big Mountain House.
Yes. So, and then we chose, so the Mountain House is where we tangibly put into action what, we have as our vision for So Big, and just, we chose the Mountain House because we knew that God would move mountains to reach these women in need.
Okay.
So.
The meaning behind, okay, it makes perfect sense now. It is catchy, and it makes you wonder what it is, and now I have a full understanding of that. So describe how the Mountain House, the So Big Mountain House, works and how women are able to stay there.
So they can, we find women can get connected with us through a number of different places in town. So we've reached out to places like Life Centers, Women's Care Center, the different hospitals, and so that would initially kind of meet these women at the very beginning, and then they call us and we go through a couple interviews just to make sure that we can fill their needs. And then once we go through that process and they come to live with us, then we just we work with them. We have a social worker that works with them in setting their goals for what their goals are for education and job, what their goals are for promoting healthy pregnancy and relationships, and just kind of the whole scheme. And then we just start walking with them and asking them where they need us to help them in that.
Let me ask you this, because what do the women say they want once they have found themselves in that situation? What do they say they want, or what they wanted when they found out they were pregnant or with this guy? What were they seeking? Did they think they were going to stay together? I'm just interested in some of their stories in terms of what they're going through as women.
Yeah, I think some of them, they thought that they would be with their partner, but other times, they just, they reach out to us because they just realize that they want a better life for themselves and their children, and they just want to be able to take that step to improving. They see what they've been doing isn't working, and so they just want some help in creating some new steps.
If they hadn't gotten pregnant, what were their lives like before that? Were they on their way to going to school, to doing those things? Were they focused typically?
Some of them. So then this is just kind of a step back of, they're not going to have that straight path to education. They're going to have to figure out how to balance school and work together and things like that.
Okay, I was trying to get a feel for what their lives were like before. And then let's talk about after. Once they come to the So Big Mountain House, what happens there while they're staying there?
We just help them in terms of if they're having trouble with, like, transportation and childcare are probably some of the bigger obstacles, and so we just help them get that arranged, and then assist them with their volunteers that help us that also help with transportation, childcare, things like that.
Because I was thinking there's some kind of programs or something that they fall under while they're there as well.
So we just, we do have a program called Transformed that we're partnering with the Wheeler Mission. And so that's a class that they will, we're just getting that started. They'll be taking twice a week with us that teaches self-awareness, conflict resolution, financial management. We also have volunteers that where we're developing an advocate program. So we have medical advocates that go to the women's appointments with them so that they can be a support system and make sure they understand everything that's going on and to help promote healthy pregnancy. And then we also have financial advocates that start walking with them and start helping them, develop budgets and figure out their spending and doing things like that.
Okay. I guess what really hurts me sometimes about, when I see women in that situation is that they were not financially prepared for that, and you're really in a bind, and which we talked about education, why all that's, it's and ideally, good to get that straightened out ahead of time. We know life doesn't necessarily go that way, but a lot of times we end up in bad situations, or in a shelter or in a situation like that because we're not financially able or capable. And that just really bothers me because I think some of it has to do with the lack of opportunities even when we're younger. Or when I was growing up, I remember having conversations with people that I even wanted to go to college, and they told me, well, why do you want to do that? You're just trying to be a man, just because I wanted to go to school. So I think some of those things that have happened to women in the past, and then when you find yourself in a bind, you can't get out of it. And yet where the guy will go on and he's gone to school or he goes on with his life and gets a job, but you're kind of stuck. And that really bothers me, to see that. So I just commend you for what you're doing because giving those women a new start. Yeah. And so what do you want to do in the future? What's your vision for So Big and So Big Mountain House?
Well, we would love to have other places around the Indianapolis area, other homes, other mountain houses, and then I'm also interested in looking into having a shelter just for pregnant women in the downtown region. So, so we'll see where God takes that. But those are our dreams right now.
Okay. Now, can people volunteer? Can people donate? What do you need?
Yes. So we are taking donations. We're looking, for people to become monthly sponsors as well as to just give one time financially. We have also on our contact page, you can hit a volunteer button, and there'll be areas where you want to volunteer. And we have a volunteer coordinator that then connects you and contacts you to get you plugged in. We're having a gala in September on the 27th, and so we're featuring a comedian, Johnny W., that's coming, and just a lot of fun events, and so hope to just, raise funds so we can continue with the Mountain House as it's going.
Well, we appreciate you coming in. We've got that on the screen, and we'll keep it up there for a second so people can know to buy a ticket to the gala. So we have Dr. Lori Buzzetti, founder and president of So Big and So Big Mountain House. Thanks so much for joining us.
Thank you for having me.
On Inside Indy, and thank you for joining us. I'm Kelly Vaughn. We'll see you next time. Bye-bye.